there, I'm Tiffany Wuebben, and I'm so excited to have you with me today. Communication is at the heart of every successful patient interaction, and today we're going to talk about a game changer that can make those interactions smoother, clearer, and more effective. What I'm talking about is, yes, scripting. Now, I know what you might think about scripts. That sounds a little bit robotic, right? But trust me, when done right, scripts are anything but robotic. Instead, they're the key to consistent, confident communication that makes patients feel heard, informed, and cared for. Are you intrigued? Stick with me. By the end of this session, you're going to be inspired to craft scripts that fit your practice like a glove. All right, first things first. Why bother with scripting? Picture this scenario. A patient asks one team member about a procedure and gets a detailed, reassuring explanation, but then when they ask someone else, they get a completely different and less helpful response. The inconsistency might leave the patient feeling confused or even untrusting. Scripts solve this problem by standardizing the way we communicate. They ensure that no matter who a patient talks to, they get a clear, consistent, and confident answer. And the best part? Scripts don't constrain your personality. They give your team a starting point, a foundation, so they can add their own little warmth to it, right? And that's where the empathy in every conversation comes in. Another benefit of scripting is how much it boosts confidence, both for you and your team. Have you ever been caught up off guard by a tricking patient question or felt a little flustered explaining a complex procedure? Scripts take all of that away. It takes away the uncertainty. They provide you with well thought out, polished answers you can rely on so you're not scrambling for the right words in the moment. And when you communicate with confidence, patients feel reassured. It's a win-win for everyone. Now, how do we put scripting into action? First, identify those moments in your practice where clear communication is absolutely essential. For instance, explaining treatment plans, breaking down financial options, or addressing common concerns like, why do I need x-rays again? These are all perfect opportunities to script out your responses. Here are a few examples to get you started. Imagine a patient asks, do I really need this procedure? An effective script could be something like, that's a great question, and I want to make sure you're completely comfortable with why we're recommending this. Based on what we've seen during your exam, this procedure will help address, and then you address the specific issue, and prevent it from becoming a bigger problem down the line. I'd be happy to go over any details or answer any questions to give you peace of mind. Notice how this script is informative, empathetic, and leaves room for further discussion. It's perfect. And the response from the patient will be such that too. Another common situation might be addressing financial concerns. A good script here might be, I completely understand that cost is a factor. We want to make sure you get the care you need. So we'll walk you through your insurance benefits and any payment options to help make this more manageable for you. This script both acknowledges the patient's concerns and offers solutions, putting them at ease. And remember, scripts can go beyond patient interactions. They're also incredibly useful for training new team members. By providing scripts for common scenarios, you give them a clear framework to follow as they get comfortable with your practice's communication style. It helps them. Over time, these scripts become second nature, helping new hires transition seamlessly. Now, I know the idea of introducing scripts might feel a bit daunting at first, but here's the beauty of it. You can start small and customize as you go. Begin by scripting for just one or two scenarios that pop up frequently. It's like the questions that always come up. And then expand from there. And don't forget to involve your team in this process. They're the ones who will be using these scripts day by day, so their input is invaluable. Sit down together, brainstorm common situations and common questions, and build scripts that feel natural and true to your practice's voice. All right, before we wrap up, here's a quick summary for you. Scripts are a powerful tool to ensure consistent, confident communication with your patients. They help standardize interactions across your team, leaving no room for confusion or miscommunication. Plus, they boost confidence by giving you polished language to rely on, even in tricky situations or when we're rushed. Start by scripting responses for common patient questions or concerns, and tailor them to fit your practice's unique style. And don't forget, scripts are flexible. Use them as a starting point and add your own warmth and empathy to make every conversation authentic and feel personal. I challenge you to take this concept back to your practice and give it a try. Identify one scenario where communication could be smoother and work with your team to draft a simple script. Practice it together, tweak it if you need to, and see how it transforms your patient interactions. The result might just surprise you. Thank you so much for spending time with me today. Building trust and clarity through scripting is such a huge value, and it's a worthwhile investment in your practice with you and your team and your patient's satisfaction. Keep shining, keep building those definite positive connections with your patients, and I'll see you again real soon. Take care.